Angela Fishman. I am a pelvic health physical therapist, and I am super excited to be here today with Tara Drerup. Tara is a certified nurse midwife, and whenever I work with women who are kind of learning how to prepare their pelvic floor for delivery and wanting to make sure that they can lower their risk of tears and they have interest in kind of protecting this area of their body, I often get asked questions about labor and delivery positions. And so I thought, who better than a certified nurse midwife to ask those questions of? So, Tara, thank you so much for joining us today.
Thank you so much for having me today.
Well, let's just kind of jump in here a little bit. If we talk about labor positions, and as well, we'll talk about delivery positions too, but let's talk about labor for a minute. Are there certain positions that are kind of your go-to positions you recommend, or kind of how do you start that conversation with one of your clients?
That's a great question. So many women come into the labor and delivery process having taken classes or having some predetermined ideas of what they think a good, labor position or delivery position would be. And
Mhm.
I will say, and you're going to hear this a lot from me today, really, it depends.
Yeah.
There are a lot of things to consider. Obviously, do they have an epidural? Do they not have an epidural? What is their birthing history? Have they been laboring for 24 hours or have they been laboring for 2 hours? And all of that really plays into what the best position is. Um, and again, especially their birthing history. So, if this is a mom who this is their, third or fourth baby, that's going to be an entirely different scenario than if this is their first baby, or if they've had significant tearing or something like that with a previous birth.
Okay. One of the things that I try and teach in the course that I have for birth prep is to practice lengthening their pelvic floor in some positions that they might be considering to at least labor in. And then again, we'll talk about delivery in a minute because I know that's a little bit different, right?
Right.
So during the labor, are there positions that you'd recommend that they try? Because sometimes there's so many different ones. I know when I had my kids years ago, there weren't that many positions people talked about, but are
Right.
there a few that you would give them as like, here's the ones that I for sure would just kind of start with. These are good starting points to be able to do some of that practicing of relaxing and letting go of those muscles.
Yeah, definitely side lying is good for a lot of people. In that position, especially with the use of something called a peanut ball, which is exactly what it sounds like. It's a kind of like a birth or exercise ball that is shaped like a peanut. That can give people a lot of benefit for relaxation because they're not standing, they're not clenching, you know,
Mhm.
they're not having to use those muscles. They can kind of just relax into that position. So,
That's
especially if somebody is feeling the need to rest and isn't feeling like they want to be up as much, or if they have an epidural, that can be an excellent position um, for for laboring for nearly everybody.
and explain the peanut pillow, did you call it?
It's a peanut ball.
Wow. Explain it a
Yes.
little bit to me. If you're on your side, are you draping one leg over it or how
You
does the peanut
are.
shape
So it's
work?
kind of like an extreme sideline position. So for most people to be as far onto their belly as they can almost, to where they're
Oh,
almost
okay.
lying on their belly with
Mhm.
that knee and that leg flexed and up over that peanut ball is going to be kind of the standard peanut ball position. And
Yeah.
then there are a lot of other ways that we can use the peanut ball in all kinds of positions, but that's kind of the standard peanut ball relaxation position.
Okay. Okay. That's great. Do you find that you need to be in more of like a birthing centers for them to have a peanut ball or peanut, what did you call it?
A
I already
peanut ball, peanut
peanut ball.
ball,
It
yes.
sounds so funny to me. It's not rolling off my
I
tongue.
know it doesn't sound right. Yes. No,
Or like
actually,
most hospitals have them as well?
most
Or
hospitals have them, yes.
okay.
And that's been a fairly recent change within the last 10 or so years that they've really recognized the benefit of the use of a peanut ball during labor, especially with epidurals and when women aren't as able to get themselves in, a multitude of positions on their own.
Right, right. Okay. How about like upright positions? Do you recommend upright positions at all? I know there's
I
some evidence
do.
that it can, shorten labor a little. The evidence to me is kind
Yeah.
of a mismatch of a lot of different things. I can't really
There
find one thing
is,
it says.
yeah, yeah. So I really like upright positions for women. Again, definitely if they don't have an epidural or if they're not super fatigued. So that fatigue piece comes in a lot.
Mhm.
And sometimes it can be harder to relax in a standing or squatting position. And
Sure.
so it's not necessarily like there are a lot of articles, books, and whatnot out there that'll say you need to be upright, you need to be moving. And
Right.
really, it depends. Again, it depends. You know, there's a lot to be said for conserving your energy as well, especially if you are unmedicated, because it can be a very long process. So, um, a lot of the positions I'll use for upright, you know, especially if somebody is fatigued, is maybe sitting backwards on the toilet. Um,
Hmm. Yeah.
that's a great, and many of the positions mimic a squat without being in a deep squat. So whether it's sitting backwards on the toilet, using a birthing stool, which is similar to a toilet seat in a lot of ways, but not on the toilet. Um, and then the peanut ball kind of gets at least one leg into a simulated squat. You know, we get very creative with the implements that we have, right? So
Yeah.
in the
Yeah.
tub, you can sit sideways in the tub and kind of have your feet up against the opposite side in kind of a simulated squat. Or on the birthing bed in the hospital, they're kind of, you know, if they have squat bars, you don't have to be necessarily upright in squatting, but you can be kind of reclined with your feet up on the stirrups or on the squat bar, and
Mhm.
that can be beneficial too.
Okay. Okay. And I know when you're with an epidural, you're more limited.
You
Um,
are, but you would be surprised the positions that we can comfortably get people into. And upright doesn't necessarily mean standing, right? So
right.
upright
That's a good
basically just
distinction.
means not lying flat. So even hands and knees is considered an upright position.
Okay. Okay. How about now as we move into delivery?
Mhm.
Do those recommendations change at all? Or I know it will depend, which I love that you said that because I do try and tell people you can plan all you want, but so many factors come into it that you have to be
Right.
able to be a little flexible with what you think is going to happen, you know?
Correct. Yeah. And positions that work really well for some people do not work well for others. Either they're not able to feel grounded or they're just not able to kind of get purchased with pushing and that sort of thing. And so that's a big factor as well. And I think a lot of times we really strongly emphasize not on your back, right? In
Hmm.
classes and whatnot. But sometimes on your back is where you need to be because that's where you're getting the best progress. And
Yeah.
that's things are the most effective. For birth, the difference is that, especially for first time moms, or unless you know, certain cultures around the world, they sit in squats. We don't do that here. So,
Right.
so the benefit of that is not as great and it increases the risk for tears, especially for first time moms to birth in a squatting position, especially a deep squat or on the birthing stool or something similar. So often we might be pushing on that stool, or we might be pushing in a deep squat to get that progress and to really have that gravity help. But then when it comes to crowning and time for the baby to be born, then we will change positions into something that doesn't put quite so much tension on the pelvic floor to minimize the damage and tearing that could occur there.
Well, that's interesting. Okay, so they might be doing the squatting to get them to the point of when they're going to get ready to push, but then you can change position. You don't have to deliver in that same position. You could
Correct.
actually change.
And you
Okay.
might be pushing up until you can see baby's head or until baby is past
Okay.
that pubic bone. And then you would change position because it's really the delivery of the head and the shoulders that is the time when, you know, tearing is the most common.
Right.
So if we can, you know, get to that point and then move, we take that tension off of the pelvic floor and off of the perineum. So we reduce that risk of tearing.
Okay. Okay. That's good to know. I wouldn't have even thought of it in that term, in those terms.
Mhm.